Welcome to this webinar on how to boost patient collections, presented by PracticeWeb. We're excited to share some incredible strategies that are going to help your practice maximize your patient collections and really get paid for the quality work you do, which is always a challenge and hits your bottom line. This is part 2 of our Billing Magic series. Go ahead and check out part 1, which will help you boost insurance collections if you haven't done so already. I am your presenter, Neil Kotari, the Chief Operating Officer of PracticeWeb, and I'm very happy to join you for this webinar. I want to get into the big problem involved with patient collections, and it's really a $5 million problem. And why do I say that? Well, if you take a practice that is making 1.5 million in annual production, and you look at two different scenarios. You have the top 10% of dental practices that are collecting around 105% per year of their collections, and then you have the bottom 10% that are around 94.5%. Those numbers are from a Dental Intel 2020 study. And if you're wondering how can you be over 100%, it's if you're collecting for previous years that you weren't collecting before. So this is the top 10 and the bottom 10%. Take the same practice, but the only difference is their collection rate. And what do we see happen there? Well, the annual collections are going to be vastly different. You're going to have a $165,000 annual loss for the practice that's in that bottom 10%. And I will mention that 94.5% collection rate is actually quite higher. I mean, there's some practices that are even lower than that. So we're being really conservative here in how much loss is involved with the bottom 10% of dental practices. But conservatively speaking, at least $165,000 a year in annual loss, just because of a less effective collection rate. Now, over a lifetime of that practice, let's take 30 years, you are looking at around $5 million in lifetime loss. That's $5 million of work that you did that you were not able to collect on, which you should have been able to. And so you really lost $5 million that you were owed as a dental practice by having a lower collection rate. So this is a $5 million problem at a minimum when it comes to patient collections. Now, let's get into some background as to why we have this problem to begin with. Well, first, some of our patients are struggling financially. Certainly in the last 18 months, a year, it's been difficult for many folks. And so what we see, and these numbers are even from before last year, so it could be even worse now, but 1/3 of patients are without dental insurance. So that's something to know, that that large segment is paying out of pocket. I've even seen numbers around 50%. So a large segment are not getting any assistance from insurance to pay for their dental care. And another, in the survey done by the ADA, they found that 40% of adults will not visit a dentist in the next 12 months simply because of cost concerns. So they're not going to come to a recall, they're not coming for a new patient visit, and they're not coming for major treatment. Of course, if they're having a major pain in their mouth, then they may show up, but 40% do not plan to visit in the next 12 months simply because of cost. So patients, they're either struggling financially or they simply see a cost prohibitive element to dental care. The other problem is once they do go to see a dentist and they get that care, their healthcare bills are a low priority. In a survey done by McKinsey a few years ago, they found that healthcare bills are far down in the level of priority or the rank of priority for adults. Other things rank in front of that: mortgage, utilities, credit card bills, even their auto loans are above healthcare bills. So that is another issue, which is the prioritization of those healthcare bills. What are the reasons why patients don't pay? Well, You can imagine that number one reason would be they couldn't afford to pay, or they think they can't afford to pay. Another important reason is that they thought something would have been covered by insurance, but did not end up being covered. So that's a major issue why they don't end up paying their dental bills. Another one is that there's a communication problem where the owed amount is unclear to them. What do they actually owe to the practice? Or they feel that the bill is incorrect in some way. Finally, you have, I forgot to pay, I wasn't sure when I had to pay. So these are some other reasons that showed up on this Waystar survey that was done of a large amount of patients. What do patients say that's going to actually help them pay? So you have financial assistance. So if they can get better pricing, they can get some discount. That's going to be number one on the list. The next thing, which is interesting, is a clear breakdown. Again, going back to a communication gap between dental offices and their patients, they need a clear breakdown, or maybe they need a better explanation of what they are owing and why. A third way that patients say will help them pay is a payment plan, some sort of a financial arrangement that will allow them to break that up into a few payments over time. That's 38% of those folks surveyed. And then 24% said that clear due dates would be helpful to make sure that they pay on time. This is again that Waystar survey, and they asked, check all that apply. So what are all the reasons that would help you, or the ways that would help you pay your dental bills? So that is some excellent background. I think it really sheds light on what's going on with the size of the problem and why we're in that problem to begin with. We're going to get into some strategies now, and we'll share some more statistics and background on this, but let's get into strategy number one on how to solve that $5 million problem. It's know your patient balances and collections rate. So that's strategy number one. Where are we? And what do we need to do about it? So the first ratio that you need to know about for your practice is your collections to production ratio. So there's a real nice formula, very easy, that you can use to determine this. And if you don't know this number, I really suggest that you figure that out as soon as possible, because it can help you figure out where you are. So the goal for collections to production ratio is 98%. This has been widely accepted in the industry. Some folks even say 99%. Obviously, we would love to have 100%. That's sort of unattainable, but you would like to have a 98% collection ratio. So if your collected funds taking a 1-year period are around 1,470,000 and your net production is 1.5 million, then you're looking at that ratio of 98%. So we suggest looking at it over an annual period as opposed to a monthly period, because you can have variation between production and collections in any given month. So if you spread it out over a year, you'll have a better idea of what is going on. The next thing to note about this is, how do we get that information to determine our collections ratio? Well, we go to support reports in PracticeWeb, and once you're in reports, you go to the more options under production and income, and then in that report you select the annual report type, and I would use the dates of the previous year. So in this case, January 1, 2020 to December 31, 2020, and you generate that report. And once you generate it, you'll see at the end of the report that there are two of those numbers that we are referring to. The total production is going to be your net production amount, and then the total income is essentially the collections for that period of time. So you take, again, the income or collections, and you divide it by the total production, which is net production, not including your adjustments and write-offs. And then you will get that ratio, which again, we hope is close to 98%. If you're at 80%, 70%, 90%, you have a lot of room for improvement there. And that's really what goes back to that $5 million problem. So after we've determined that collections to production ratio, the next ratio we really care about is accounts receivable to production. And this is really important. I'm going to explain why, but we want to know what the accounts receivable to production looks like. And it's a slightly different formula here, but still very simple. And in this case, you're going to look at a monthly time period. And the goal here for this ratio is 1. You want to hit 1. If you're above 1, that means you have a large accounts receivable to a smaller production. And if you're below 1, you have a large production to a lower accounts receivable. But essentially the goal is to hit that 1. That's the right balance. So let's take, on a monthly basis, you have 125,000 at that month in accounts receivable, and then you have 125,000 in monthly production. Now you're hitting that ideal number of 1 for this ratio. Now, why do we care about AR and what the AR looks like over time? It's because patient balances lose value the longer you wait to collect on them. So in a dental economics study done, they found that if the AR is within the 0 to 30-day period, you're looking at a 94% collection rate. So you have a high likelihood to collect if you move quickly and you act quickly. Then if you get to the 90-day period, you are down to about 75% chance to collect. Then you're looking at the 6-month period to 58% collection rate. So almost 1 in 2 chance to collect on those balances. And then if you get past the year mark, then good luck, because it's about a 1 in 4 collection rate. So as you can see here, patient balances lose value over time. You need to really make sure that these balances don't get out of hand, don't get too old. And there's many reasons for the reduced collectability here. Why it's so hard after a long period of time. It's because patients are going to care less if you contact them 90 days later, 6 months later, a year later. They are going to be harder to get to pay, and you've put so much labor and time into it, inflation, so the value of that money itself is going down, and you've thrown so much effort and money into it. So you want to move quick. Now, age distribution of the AR, what should that look like? What's ideal? Well, ideally, it would all be within the 0 to 30-day period, but we know that that's not always going to be the case. And these are some benchmarks provided by Pearly, which provides some AR services, and they decided that 75% of your AR should be within the 0 to 30-day period. So if we take that example of 125,000 in AR for that month, then you're going to have $93,750 in that 0 to 30. Then we look at the next period, which is 30 to 60 days. How much of your AR should be in the 30 to 60-day period? About 15%. So that, in this example, that would be around $19,000. Then we get to the 60 to 90 days. We should have about 7% of our AR out there, and that would translate to around $9,000. And then you have 3%, that remaining 3% should be in the 90-day plus period. If at all, if any is in the 90-day plus, it should only be about 3% or less. And that would translate, in this example, to almost $4,000. So this is the ideal scenario, considering the fact that you're not going to get to perfect where everything's within 0 to 30 days, but this is where a good practice would be at. The problem is, as found by e-dental assist billing, you find that the average practice has 18% of their AR in that 90 plus days period. So a large amount, almost 20%, is way out there, and some practices are even worse than that, so in their worst position. This is the reality, right? So we can see how far we are from the ideal targets of the age of your AR. Now, how do we find this information in Practice Web? Again, go to Reports and then the monthly section of Reports, and you'll find an aging of AR report. And if you run that, you'll find the distribution. This is an example of a practice in a very bad position because most of their AR is more than 90 days past due. And using these figures here, you can see the distribution. You can also divide the numbers within each period of time by the total, and you'll see what your percentage distribution is and compare to those benchmarks I just showed you. So this is where you can get the data and see where you are in terms of your AR. Now that is all discussing the big numbers of your practice, the collections to production ratio, the AR to production ratio, the distribution, the age distribution of your AR. Now, another thing we need to know as much as possible is anytime I'm working on a patient, I should know what their specific balance is, their individual balances, and their entire family balance. So there are obviously ways to go into the account and check this when a patient is either making an appointment or you're doing a follow-up call or they're walking out of the office. You can go into the account module and check this, but in a fast-paced office, sometimes you miss things, sometimes you don't have time to check all of that. So we provide tools to make it even easier for you. And one of those tools is Smart Caller ID. This is a tool that gives you a very nice, intelligent dashboard that pops up anytime a patient calls in or when you call out to a patient. You can also pull this up by clicking on a button in PracticeWeb in the top toolbar, even if you're just working on a patient within the database. So it's a very nice dashboard for that patient. Among many other things, it's going to show you very clearly what their balance is at that given time, and also a breakdown for the entire family. So this is a great way to see things, whether they're calling in, you're calling out, or you just want to click that button for this Patient Express tool and look at the Smart Caller ID and see what's going on with the patient. Another tool is the patient dashboard, and this is included in PracticeWeb already. All of you have this if you're on the latest version, and this will always be sitting there on the right side, so no one's going to miss it. Any patient that you're working on, whoever you have selected, the dashboard will show all of the key information you need to know. And one of those key facts is the balance and what the balances look like. So you can see here in the screenshot in the top right, there's a total family balance and family estimated balance appearing. And you can even present more information on this dashboard. It's fully customizable to your liking. This is already part of PracticeWeb, and you should be using it to help get a good eye on those analytics for your entire office. So that's knowing your numbers. Strategy number 2 is let's now start at the beginning of the cycle. So I kind of started at the end with knowing the numbers. Now let's start at the beginning in terms of the actual cycle for each and every patient. And the beginning of that cycle is have a workable financial arrangement with all of your patients. So what does that mean? Well, it starts with a comprehensive financial agreement with all patients. So all of your new and existing patients should be signing and submitting the current version of your financial agreement. So if you've updated it recently, maybe you're going to update it after you see what I'm about to present here. Have everyone be on that current version. You might have a patient that signed it 5 years ago and you improved it, but now they don't have that contract with your office because it was 5 years ago. So that's number 1. Number 2 is what should be in the financial agreement. Well, we think that at least you need to be addressing the following topics and make sure they're not in complete legalese where you can't understand it. The common person can't understand what they're signing. Have it as much in plain English as possible. What are the topics? Well, there are a lot, but it doesn't mean you have to write a novel. You can get all of this into your agreement, half a page, 1 page at most. Number 1 is, as you know, the patient has to authorize you to release information to their insurance company when you're doing billing. So have that in there. If you have a policy, which we're going to get into later, for upfront payment for major work or any sort of similar payment timing policies, you should have that in the agreement. Then, you know, and an example of that is payment in full made right after treatment, let's say for cash patients. So that should be your standard policy, and that needs to be in the financial agreement. Then for insurance payments, insurance patients, it needs to state that the deductible, co-pays, and non-covered fees are paid at the time of service as well. Now, if you get to the point of collections because a patient is not holding up their end of the bargain to pay for their treatment, then that needs to be clearly stated in bold. This is what's going to happen. This is worst case scenario if you don't pay, so that no one's surprised or upset that they were sent to collections. If they're not holding up their end of the bargain, that is the ultimate consequence. That needs to be in the financial agreement. Then their full responsibility to pay no matter what insurance reimburses has to be clearly stated. If you are treating children, and even if you don't think you would be, but just have it in there for the parent or guardian's responsibility to pay for children. Then the patient needs to know that it's their responsibility to understand their own insurance benefits, and also that your office simply does or does not, if you don't do this, file insurance claims for them as a courtesy. So you're doing it on their behalf. And then finally, late cancellation or missed appointment fees, any billing charges for late payments, and then if you do run credit reports, then they should consent to that in the financial agreement. So this is the kind of checklist you should review your financial agreement next to. And if there's I'm sure other topics that you might want to include in there. So that's the starting point. And one thing I want to plug here is that with PracticeWeb included in your service are mobile forms. So this, can be used for any patient forms, whether it's patient registration, medical history, HIPAA, and also financial agreements. So it's very easy to get them signed. You can send mobile forms to patients, and it's very easy to fill out on their phone and sign it and send it back, and it goes right into PracticeWeb. So use your mobile forms to complete the financial agreements among many others. Now, if you need to modify the default agreement that we provide, and ours is just a default, very basic agreement, you should go ahead and look at that, modify it, and maybe you already have done that, but look at it again, make sure all of those items on the checklist are included. Just go to Setup, the Setup menu in PracticeWeb, and then Sheets, and you can simply go to the financial agreement over here. And if you don't have it here, that means you're probably not using it. Then it's going to be on this side, and you just copy it over, and then you double click on the financial agreement once it's on the right side, and then you can modify that as you wish. So I can show you an example of that right here. So this is what the default might look like. Again, you may have already modified this, but go in here and just check it out. You should review this every year, just like all your other forms, and make sure they're up to the standard that you have. Another thing to do, very, very highly recommended, is to post reminder signs in your office, because patients are not reading everything they sign. That's obvious, and it's just a reality. So anything very, very important in terms of your financial policies, you should post reminder signs. And I would say, put them in high traffic places. So obvious areas would be waiting room, wherever they're checking in, checking out. Post these signs mentioning things like payment is expected at the time of service, if that's your policy, what payment methods you accept. If you do offer financial arrangements like payment plans, then mention that so they're aware. So have these reminder signs in your office. Now, patients should also be reviewing and signing treatment plans. And this is very, very useful. I think some offices are strict on this and they do it very well. Others are a little bit lax. So we don't want to be lax when it comes to treatment plans. I would say it's a great next step, because a financial agreement is just a generic agreement. So this is a great next step when you're actually getting into about providing treatment to patients. So always present and explain a clear cost estimate to patients before treatment. And that essentially is the treatment plan, but you need to sit down and talk to them about it. Clarify to the patient that insurance estimates are just that, estimates, and that the patient needs to pay any remaining balances. This is where, going back to those surveys that we presented, patients are surprised, maybe despite your best efforts, but they're surprised that insurance didn't cover something or that they have what their portion actually was. On the treatment plan, you should have a clear, plain English note mentioning your policies about all of these things, and then make sure that treatment plan gets signed and provide a copy of the signed version to the patient. So this is a very ironclad kind of buttoned up approach that we recommend. In Practice Web, you can select any of the procedures. So if I'm in the active treatment plan, I would select any of the procedures to get the patient to sign off, and then click the Save TP button. That'll create a Save TP, and then when you're ready for them to sign, you simply click Sign TP, and that will allow them to review it and put their John Hancock on there. So this is going to be the process for getting that signed. And this is where that preview shows up. So when you click on Sign TP, this will appear. If you have a tablet, PC, then that's a great way to get them to do it. Let's say even in the treatment operatory. Or you can use a signature pad like a Topaz pad that attaches to the computer, and they can sign it that way. We also have an iPad app which does all patient forms as well as treatment plan, and they can sign it on an iPad. So if you're interested in that, let us know, and we can set you up with a free 30-day trial on that. But however you get it done, get the patient to sign off. And another great thing in Practice Web is you can have the staff person, whoever reviewed it with them, sign off as well. So this is where, if you look at the bottom here, that's where the note I was mentioning should appear, and you can put it in all caps if you really want them to make sure to read that. But this is a great treatment plan which shows what work's going to be done, what is the cost breakdown, how much insurance is going to cover, how much they're going to cover, and what their benefits look like if they have any insurance benefits. So this is all, once you get this signed, it's always going to be available to access. You simply go back to that saved TP. So if we go back to this screen, you simply double click on this again after it's signed. Once it's signed, there'll be an X here, and you will be able to print or view that signed version again. So you don't need to print it out or create a PDF, etc. But as I said, it is useful once you get it signed to give them a copy. You can email it to them, you can print it out for them, etc. So get that document signed. This is an example of a clear note. So you can modify the note if you go to Setup and then Treat Plan. There's an area here that I've shown, this default note section, where you can modify that. I've given you an example here that simply says, I have been informed of the treatment plan and associated fees. I agree to be responsible for all charges for dental services and materials not paid by my dental benefit plan. And then there's some exceptions to that. So whatever you feel comfortable with, that you feel is a very clear note about your policies, that should be on the treatment plan. Now, the next part of this with the financial, have a workable financial arrangement with your patients is a payment plan. So the statistics are that there's certainly a trend towards more and more patients getting on payment plans. In a study done by Instamed for 2020, they found that the age group under 40, about 39% of them have financed their treatment, whereas above 57, the baby boomers essentially have only 10% of them have financed. So you can see a trend towards financing, and it's a significant segment. Now, why is this the case? Why are payment plans popular? It's because in a study done, in the same study done by Instamed, they found that 24% reported not being able to pay a $400 dental bill in full, more than $400 dental bill. So that's a quarter of patients not being able to pay for major work or even basic work. So this is the problem, and this is why the payment plan would really help them pay and accept treatment, but and also do it on time. So what are some guidelines when it comes to payment plans? First of all, I would highly suggest don't assume or prejudge that a patient can't pay in full. Be confident that your fees are reasonable, that they're affordable for most people. So another strategy we're going to talk about later on is getting patients to pay upfront even, or at least at the time of service. So don't assume or prejudge or jump too quickly into payment plans, because there are obvious disadvantages. You're getting paid over time, and you're not going to get that payment right away. So that being said, if you are getting into payment plans, generally speaking, you should try to use outside financing for, especially for large sums. You don't want your dental office to become a bank, and that is why we recommend doing this outside financing. Another thing you should do is limit your payment plan schedules to 2 years maximum, if possible. If you're going to be doing that payment plan approach, then the longer you stretch it out, it just becomes a bit of a hassle, and you get worried that are they going to actually fulfill that in that long period of time and getting all those payments in. So 24 months is a kind of a good maximum benchmark. Then next thing is most offices nowadays do provide no interest plans. If you're going to do financing, this is if you can swing no interest, that's a good thing to do, because you're going to get more treatment acceptance and it's going to be much more appealing to patients. So that would be another guideline if possible. Now with PracticeWeb, you can do your payment plans from the account module, and I'm sure a lot of you have used this before, but there are a few pointers, even to the folks that have been using this, that you should be aware of. So if you go here, do the payment plan, one thing we highly recommend is try to use this View TX Credits button in order to link up the procedures that are going to be covered with this payment plan to the actual payment plan. So I've seen offices just do a kind of a generic payment plan that's not linked up to any specific procedures. It's just bringing down a balance. But it is, I think, useful to instead link up the actual treatment that's getting paid for by this payment plan. So use this button here, and we have some tutorials on how to do that. The next thing is to have a good note, just like the treatment plan and the financial agreement. You want to have good language in your payment plan, because this is another thing you should certainly get signed if you're going to be providing a payment plan in-house. So this note is a default note. You can add any other language here that states your expectations that they pay on time, what happens if they don't pay on time, etc. And if you have a standard note that you put in here all the time, you can create what's called a quick note, and that will make it so that you can quickly choose that same note again and again every time you do a payment plan, and plug it in here with a few clicks. Finally, like I said, get it signed and print that out. Give a copy to the patient. So what does that look like? You have the payment plan terms at the top. Once you click that button, it's going to generate this document. You have the payment plan terms at the top, the note, then you have the signature block. So that's, again, where you can sign either on a tablet or connect a signature pad, like a Topaz pad, to your computer. And once they have reviewed this, they can clearly see what their responsibility is, what's the expected monthly payments or quarterly payments, what's the time frame of that, and all of that information. So it's kind of like a truth in lending statement. And then down here, you can choose many different methods to get that over to the patient. This is really not for you as much, because you could, if you want to save this somewhere, you can, but this is always going to be in that payment plan. If you ever go back to that payment plan and account module, you double click in it, you can always print it out or create a PDF. So don't feel the need to do it right here and when it's being signed. It's more for the patient to receive a copy of that. So another thing, if you are going to do payment plans in-house or any sort of recurring payments, we highly recommend checking out PayConnect, which is a dental exchange service. And with that service, if you have that integrated card processing, one of the things that comes with it is auto recurring credit card charges. So you can actually have patients save a card on file and then get them charged automatically on whatever period of time you've decided. So if it's a monthly payment plan, you don't have to worry about calling them up or getting payment every month. You can have it done automatically here. So we can show you how to set this up. The number one step would be to get the PayConnect service. And I'm going to talk a little bit more about PayConnect later in this webinar. Another thing to consider if you are going to be doing outside financing, which we recommend, a great service to use is called DocPay. And for those of you who don't know DocPay, they are incredible in terms of their cost structure, which essentially is free for your practice. So payment plans are free for your practice. It's also very minimal cost for the patients. And what happens is, you know, their approach is that patients are getting the privilege to get this payment plan. So they should be the ones paying any minimal fees involved with that, not the practice. You're not getting the privileges, you're extending that privilege to the patient. So for the practice, there are no sign-up fees, monthly fees, or setup fees, and you also don't get any transaction fees. So you actually, this is even less expensive for you because it's zero than if you were to charge a credit card yourself in the office. What does the patient pay? So if it's ACH payment from their bank account, then they get simply a $3 fee per payment, very minimal. If it's credit or debit card payment, then they get a minimal transaction fee as they would, you know, as you would if you were running their card in the office. And that's going to be, of course, because it's a percentage, it'll be based on the payment size. The patients are emailed reminders before the payment hits their account, so they're never surprised. There are no credit checks done on the patient, and DocPay's plans do not affect a patient's credit. So that's another selling point you can share with patients to get them to sign up with DocPay. Another thing DocPay also provides are guaranteed payment plans. So they have a very good low fee of only $1 per payment and 1% of the payment amount. And what guaranteed payment plans means is that you will always get that payment. So the risk is getting shifted over to DocPay, and they guarantee that you'll get that amount. So this, if you look at all these numbers, it's less than you would pay in card processing fees if the patient was going to, let's say, even pay in full at the time of service. So it's a very good deal. Long story short, if you compare to other outside financing options out there, they generally charge 10 to 15% of the payment amount. So this is 1%, very minimal. So DocPay is a really great option for outside financing. And if you want more information on them, go to our website. We have it under the Smart Tools section. It's called Patient Payment Plans. And you can also sign up from there. There's a link which will take you here, and you can enroll with DocPay and get started. And I would try it out, and you would get some good like kind of bonus services because you're coming from PracticeWeb as well. So another final thing I want to mention about financial arrangements are discount plans, and these are also referred to as membership plans. And I'm mentioning Costco and Amazon Prime here because these are two really good examples of membership plans that have been extremely effective for these companies and popular. So similarly in dentistry, there's a very big trend of offering membership plans to patients. And in PracticeWeb, the feature is called discount plans, but it's essentially the same as a membership plan. What it does is it encourages patients to be loyal to your practice because they've now bought into this membership plan. And that's the same thing that happens with Costco and Amazon. People who are members of Costco, they shop there more often. Folks who are on Amazon Prime, they buy on Amazon more often. So same thing happens with your office. It's very, very good. And the plan also encourages payment on time because, as you remember, one of the number one way to help patients pay on time is provide some discounts or financial assistance. So this is going to get people to pay on time. There's a slight note here to check state law. I did see some stuff about license or registration requirements, but you may or may not have that in your state. Just check it out, make sure it's you're doing it in a compliant way when you're offering these membership plans. So patients do pay a monthly or annual subscription to your practice, and they can do this for preventive care and discounts off of major work as well. In PracticeWeb, the discount plans feature uses adjustments to automatically, and the key word there is automatically, so you don't have to do anything here once you set it up. It automatically reduces the full UCR fee for patients assigned to that discount plan. And you can create multiple different plans for different scenarios. So this is great. I mean, I think it's great for, especially for cash patients to offer this. And how do we set it up? There's a section under lists, and it's called discount plans. That's where you would set up the plans, and you set up a fee schedule to go with that. What are those exact discounts? and then assign patients to that. So there are a couple steps. It's really straightforward. Just search for discount plans in our online users guide to figure out how to set it up. And we're gonna put out a tutorial video on it very soon. But if you look at that users guide, or as always, you can call support. These are the types of things we're here for. We can show you how to set this up for your patients. So that was strategy number 2, create workable financial arrangements for your patients. What's strategy number 3? You've done all of that groundwork. Now you've done the treatment and it's time to collect. So we want to collect payment quickly. And going back to that age distribution of accounts receivable, the longer you wait, the less likely you are to get paid, and you're losing money over time. So get payment right away if possible. Most patients can pay upfront or at least at the time of service. This is the reality. You may not feel that way because you hear a lot of excuses or a lot of complaining about this, or just pleas for help. But in the study done, earlier I referred to the study by Instamed, they did find that about 24% can't pay, but hey, the flip side of that is 65% can pay a dental bill that's larger than $400 in full. So again, serving thousands of patients, this is the reality. So most patients can pay up front or at the time of service. And it makes sense. It's not unfair. Think about going to Starbucks or a McDonald's or a restaurant or a lot of other service providers. You're expected to pay either before or right when you get your product or service. So why should it be any different for dentistry? I think some offices are very good on this, but some are very lax when it comes to collecting at the time of service. So what are some guidelines that we recommend? Most patients can afford to pay up front, and or at the time of service for most procedures. Sure, if you have a very large procedure that you're doing or set of procedures, then they may need some help, possibly a payment plan, but most of the time, most of them can pay. So based on that, you should decide a protocol that works for your office and the patient base that you particularly work with. If you're in a low income, have a low income patient base or a very affluent patient base, maybe it would change what you do here. But there are a couple of options. You can either do payment up front before you even provide service, or maybe half before, half after. A third option could be a down payment to get their skin in the game, and then the remaining at the time of service, or at least payment in full at the time of service. That should be standard. Insurance patients, because you're still waiting for the EOB and figuring out what insurance is going to end up paying, they should at least pay their deductible, co-pays, and non-covered fees either upfront or at the time of service. You should also consider offering a small % cash discount to patients who pay in full at the time of service. This will encourage them. I know practices are doing this already, so think about doing that if you're not already. And one example could be a 5% cash discount, for example. So do what works there. Then lastly, I want to mention use firm but polite language when you're asking for payment. So don't say something like, are you able to pay your balance today? A very kind of weak request for payment. You want to be firm but polite. So how would you like to pay your balance of $1,000 today? We accept these payment methods. Here are the ways you can pay. So be firm but polite. One thing that's really going to help speed up the payment is that patients want electronic payment methods, and not only do they want it, it's very good for you. It's kind of obvious that if you provide more ways to pay, you're going to get quicker payment. So 85% of patients surveyed in that Instamed survey preferred an electronic payment method for healthcare bills. And that's, you don't really need a statistic to draw that conclusion, because if you look around, everyone's on their smartphones and everyone's using credit cards. It's just the way things are going now. It's the name of the game. So 85% want that. And even more interestingly, 56% of patients surveyed would consider switching providers for a better healthcare payments experience, just on the aspect of payments they would consider switching if it's not good in one place versus another. So, some great findings here by that Instamed 2020 study. Now, how do we offer payment methods in Practice Web? Some of you are already using the options we provide. So we have 2 payment processors that are kind of full-blown in-office payment processing. The one we recommend is Pay Connect through Dental Exchange. Again, that same service that I was referring to for auto recurring credit card charges. So Pay Connect, right in the payment screen, you can process a credit card payment and not have to use a separate portal or a separate service, which some of you are doing. You can do it right within the payment screen in Practice Web, and it goes into the account module. No need to manually enter anything extra. So you click on that Payment Connect button and you can run a charge, even do an authorization of a charge to see if they're good for it. You can, if you need to void something or refund something, you can do it from there as well. So one thing that that Dental Exchange provides, if you're considering going over to them and using Pay Connect, which I highly recommend you looking into, they do a free merchant services analysis. So they'll look at your current rates with whichever merchant service you're using and show you how Pay Connect can save you money by switching over to them. So this makes it kind of a no-brainer to switch over. And then we also have integrated pay by text through ProPay. This is an excellent tool to speed up payment because you get to text a payment request to your patients instantly. So even if they're in front of you checking out, you can do this right away and they'll instantly get a text message which will allow them to pay from their phone using whatever payment method they prefer. So once you put in the payment amount, the details, you click pay by text, your patient is going to get this text message here in the top left, and it'll tell them that they have a payment to make to your practice. And then next they will see the payment amount, they can pick a payment method, confirm it, and they get their receipt, which is also emailed to them. And I'm going to show you in a moment, it's automatically entered into your account module. So this is great. They don't have to sign up for, the patient doesn't have to sign up for any extra service or be like log into something. It's really, really quick. And as I said, it shows up right in your account module automatically that you got the payment and it's all recorded. You can sign up for Pay Connect by going to the account module, and at the top there's a pay by text button. You might have seen this pop up once in a while that we put out there in Practice Web just to remind you of this service. But this is where you would sign up, and it takes about 5 minutes. If you need any help with that, getting it set up, getting a quick tutorial on it, call our support team. And we also have some information and a tutorial on that. So strategy number 4, after you have tried to get payment upfront or at the time of service, which should be your go-to, if that doesn't work, you need to have an effective and multi-pronged billing process. Having a very good kind of strategic and structured approach, and make sure it's being done consistently every time. So what do we recommend? We recommend a 6-step billing process to boost your collections. As I said, number 1 is going to be collect up front or at the time of service. If that doesn't work, print a walkout statement with a stamped envelope so that they can use that if they need to submit payment, like a check. Email, another thing you should also do is email and text the billing statement, and you can text it now. That's a new feature we've added, and I'll show you how that's done in a moment. And then finally, send a pay by text request. So now you've given them essentially three different ways to pay or to see this balance. And with the pay by text, there's really no excuse if they have a credit card to pay very conveniently. And that expires within 7 days. And that's essentially what you should expect is if I'm going to let you go here, I do expect to get payment at least within a week. So you should call within 5 days if they haven't paid. This is step number 2 in your billing process. Step 3 would be in 30 days, mail and or email a bill, which you can do through Practice Web. And it's a reminder that the account is past due. Here's what you owe us. and try to get payment that way. Hopefully you don't get to this point, but I know some accounts will get to the post 60-day period, and that's when you mail and email a more firmly worded bill. And I'm going to show you an example of a message you can put, or how to modify that message for this scenario. And that's really the second past due notice. And the third one, the final one, should be in 90 days, a final past due notice, very firmly worded. If that doesn't work, after 120 days, your standard protocol, without thinking twice, if you agree with that, should be to follow up with that 90-day final notice that you sent. Follow that up with a call and an email that their account is going to collections. One thing I want to also mention, the 60-day mark as well, you should call. So before you even send out a bill, call them and try to see if you can get it resolved, and then you would send out that one. But going back to the 120 days, this is when you want to think about and really send them to collections and have a very standard policy. Don't waver. Whatever your policy is, follow that. So this is the 6-step billing process that we recommend, but you may have a different system. Whatever works for your office, it's really your decision what to do here. So I mentioned that you can text and email the statement. That's going to this statement button in account module. There's going to be a drop down. If you click this drop down, there's a more options, and then that takes you here. And from here, you can see once you've set up the bill that you want to send out, it'll email and or text, depending on what you click here. So if you're using our PW Connect texting, our texting service, you can text them the bill for their reference as well. And I did refer to the option to change messages on your billing statements, and that will always get applied automatically. So you go to the Manage module and you go to the billing section, and that'll take you here. Unless you already have some billing statements pending, it'll show you those statements. But if you don't have anything pending, it'll take you here to generate your next set of billing statements. But I want to point you to the Setup Dunning button, and that allows you to change the messages, whether they're the bold red message or just a normal message, for any different scenario. And so you can see here, there's some different examples of what that message can look like. And there's going to be some great language you can put in here. Not necessarily this language. You can use whatever language you think is applicable for these different scenarios. So over 60 days, over 90 days. And really, to set that up, you would just click this Add button, and you can then choose the criteria that applies to that message. And actually, if you're doing emailing through PracticeWeb, you can even modify what the email message is, which the email would have the bill attached to it. So even the subject line of the email, the body of the email, you can modify that based on what is the age of the account, if there's insurance payment pending or not, and other criteria, the billing type, etc. So this is a good thing to look at, and you can call us on support again to get some help with that. So patients want electronic billing just like they wanted payment methods electronically. They want electronic billing as well. The facts are that 66% of patients only get healthcare bills in the mail, but only 14% actually want to get their bills that way. Only 14% actually want to pay by check. The rest of them want to pay electronically. So there's a big disconnect between these statistics here and what patients want versus what providers are actually doing. So we say solve that gap there and give your patients what they want. With Pay Connect, again, through Dental Exchange, patients can pay their bills online. And this is a great service where through PracticeWeb, it's fully integrated in PracticeWeb, that same billing section I was showing you earlier. You can set it up so that the bills go out electronically through Pay Connect, and every bill will have an online payment link where they can pay for their balance without even having to contact you. So similar to pay by text, you can do your billing statements that way too, essentially, and they'll get an email where they can pay online. So this is in that billing screen I was showing you earlier, there's a button there also called billing defaults, and this is where you would enter all of your account information if you do sign up with that PayConnect service for e-billing. So we can help you set this up as well once you're ready, once you've signed up with Dental Exchange. So strategy number 5 is to send all your past due accounts to an accelerator or collections. An accelerator basically allows you to offload that billing process. Let's say after 30 days, you don't want to deal with it. You can get someone else to try to accelerate and get that payment quicker, or you do a full-blown collections process. So that's strategy number 5. And one service we recommend is through TSI. We have a full integration with them. They're a huge company with a lot of great results, and they have done billions and billions of dollars of this work for all kinds of businesses, and many of them being dental practices. So TSI offers 3 levels of service. They have an accelerator service that basically takes over the billing process for you when the account is past 30 days due. They also provide a profit recovery as well as a contingency collections service. So 2 different services, and that's something you can use, recommended after 120 days to go into that stage or service. Their results are really great. That's why we decided to work with them to offer that to you as another option. Their average recovery rate is 40%, which is 3 times higher than other agencies that we looked at. And the costs of collections are about 1/3 of what other agencies charge. And it's a very low cost, which you can discuss that further with TSI. But to either use this or to sign up, you simply go to the Manage module, and then this collections button will be there. So if you don't have it already, you click that button, it'll take you to a sign up section where then you'll be able to talk to someone and get that going for you. Or if you have it already working, you would go again to that button and handle collections from there. So easy, right within the Manage module. And if you have it, then once you click that button, you'll go to this AR manager where you can see what accounts should be possibly sent to collections or even the accelerator, and which ones have already been sent, what's the status of that. So you'll see all of that right within PracticeWeb. How great is that? I mean, it's so easy compared to doing all this separately and having a separate portal, and you have to reconcile everything. This is so much better. So that's the strategy. Number 5 is have that in your policy to address those difficult accounts and really try to get something for that, because again, that's work that you've already done and you haven't gotten paid for it, and that's just not fair to you or anyone in your dental practice. That's really put in a lot of effort. So that should be the last step. I think now you're really ready to boost patient collections. We've given you amazing strategies here, some of which you may be already implementing, some of which will be new. So if you want help implementing any of those new strategies, call our support team at 800-845-9379. And option 2 is our support team. If you have any sales questions, that's option 1. And their email is support@practice-web.com. I'll do you even one better. You can simply go to PracticeWeb, the help menu, click on remote support. That'll take you right to our support form. So you can drop your name, email, phone, and your message, what you need help with right there. You always have the option to call, but this is another great way just to send it out, and then you don't have to wait for anyone. As soon as we get that message and person's available, we'll call you. But we have great availability by phone too. You're always going to get to talk to someone live in most cases. So just contact us any way you like, and we'll help you implement these strategies. And we do want to mention some special offers to get some of these strategies going. A lot of the strategies we talked about, you don't need anything extra to do them. But some of the other services I mentioned, I wanted to give you a good offer here. So Smart Caller ID, that was the one I mentioned at the nearly beginning, where it helps you really see a lot of intelligent information for every patient that either is calling you, or if you just want to click the button and see that dashboard for that patient. It's a great tool. We give a 30-day free trial. It's $149 a month. And so that's a 50% off deal. So you're going to save a lot of money if you go with that. PayConnect, which I mentioned throughout, they provide credit card processing, including the auto recurring charges and electronic billing. So they have very competitive rates, and they'll do that merchant services analysis to prove that to you. Don't just take our word for it. I would definitely talk to them, and they can be reached at dentalexchange.com. We'll send out their contact information, and you can actually look down in the description here for this video, and you'll see all of the contact information for Dental Exchange. TSI, you simply click on that button and you can fill out that form, and they will connect with you to get that going. But they have that Accelerator service, which essentially allows you to outsource your billing past the 30-day mark, and you can see what everything's going on right within PracticeWeb. So fully integrated, very good solution for either even accelerating or doing collections. And they can give you up to 66% off on the service and get going. So I would really try them out and see if it's improving things. And then finally, if you don't have support with PracticeWeb, but you want to get the latest version, you want us to help you implement these strategies, then we have a great offer right now expiring at the end of the month. It's $99 a month for support, and you'll save around $360 a year if you go with that. So those are our special offers. I do want to encourage you to keep in touch with us on social media. We're constantly putting out great information, great content, a lot of these topics that are really important. I would make it a practice to read all of our blog articles, etc., because it's really allowing you to maximize the use of your practice management software that you already have to boost your revenue and productivity in the office. So we have our Facebook page, our LinkedIn, our Twitter, YouTube, which is where you're seeing this, and then the PracticeWeb website, of course, and that's where our blog is. So a lot of great content. If you liked what you saw here, you want to see more great content, definitely like the video, subscribe. You'll get notified anytime there's something new coming out. It's great, so you don't have to keep checking, and you'll just get an email notification. So definitely subscribe and like this video, and it helps us put out more great content. With that, I'd like to say thank you, and if you need any help on the sales side, call us as well there and email us. I was your host today, Neil Kotari, the COO of PracticeWeb, and look out for more great webinars and great content coming up here. Thank you very much for your time, and have a great day. Goodbye.